Learning health system work involves taking an idea that comes not just from a provider or a researcher, but from patients and caregivers, and trying to see if we can test that to see if that's going to be important for recovery. So for traumatic brain injury patients, what we're doing is figuring out what are those ideas and how can we test them in the future.
So a learning health system is a health system. It can be a hospital, it can be a group of hospitals that continuously assess outcomes and processes in clinic, and therefore have created a feedback loop for continuous improvement and learning.
One of the things that can happen in healthcare is that everyone becomes very siloed. They think about the stuff that they know as a neurosurgeon or a rehab doctor or an emergency room doctor, and really getting all of those different types of provider expertise in a room, but also getting research expertise and caregiver and patient sort of lived experience, as well as community resource expertise all together allows us to think about how we deal and approach things in a different way. And I think that's going to benefit all of our patients in the future.
So learning health systems basically have key characteristics. The first one is that they have a strong culture of continuous learning and improvement. They also systematically use evidence-based practice at the bedside to drive care and decisions. They also heavily rely on data to make decisions, and they also actively engage patients and families in improvement activities. So they are absolutely an integral part of the improvement work.
I hope that this allows us to continue to do more things where we engage with patients and caregivers in the community. It's really powerful to be able to get insight from patients, insight from community partners. So I really hope that we continue to have this engagement moving forward.
Traditionally, stakeholders include patients and families, as well as clinicians, researchers, and community organizations. But more and more we are learning that employers, for instance, have a role to play, and we are learning that, for instance, through our TBI work. So actually the list is endless. It's basically all the people that touch our healthcare system and help our patients get better outcome.
The biggest challenge is that traumatic brain injury in a lot of ways is an invisible injury, and this is something that a lot of patients deal with because it's not always obvious that they've had an injury to their brain. And this is something that we're hoping that by having this intervention and this discussion that we can help with that a little bit.